Assalamualaikum, everybody who has joined in this morning. Welcome to the NAMCC's Mental Health Awareness session for this month. And we have Dr. Afshan Khan, one of our psychiatrists in the community, who has, mashallah, been active in educating and helping and treating people in this community for many years now. And she, as Dr. Khan mentioned, she has a special interest in, and she's in anxiety as well as all ADHD or mental health disorders and treats them actively along with her at her private practice in Austin. And she is, her information is shared in the email that we had sent for the registration. In case after this you have to reach out to her, that is the way you can, and contact her office, inshallah. So, today's topic is teen anxiety and coping skills. And Dr. Khan is going to present on.
Somebody raised a hand, Nadrat. I don't know, somebody had a question.
I cannot see that at my hand.
It says K raised a hand. That showed up.
Okay. At this time,
I hope they can hear me. You're right.
If you have any problems with the technical seeing or hearing this, please write in the chat, and we will take care of this, inshallah. Or any questions during the session, just go ahead and inshallah write in the chat, and we will go ahead and take care of your questions. So inshallah, we will start off with a dua. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم اللهم صل على سيدنا محمد وعلى آل سيدنا محمد وبارك وسلم رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي اللهم إني أعوذ بك من الهم والحزن وأعوذ بك من العجز والكسل وأعوذ بك من الجبن والبخل وضلع الدين وغلبة الرجال. So go ahead, Dr. Khan, take it from here. And if there is anything, I will just message you, inshallah.
Sure, thank you, Nadrat. Alhamdulillah, this is kind of going into our second year of doing this. The goal is really sort of use this platform to educate, talk about it, create awareness, and see if we can really understand these things, right? So this is very basic information that we're trying to provide, but also a good platform for us to kind of engage in conversations, understand concerns, how we can help our families and ourselves with these mental health issues, and which has become such a big priority now with how the world is changing. So my skills goal is to sort of just do basic and while I'm kind of going through these slides, I can talk about the examples of things that I see in my clinic and struggles we see, so we can kind of talk a little more about those things. So really stress reactions, right? Teen stress reactions, often the teens present with being worried and anxious, being depressed, negative thoughts or feelings, often not having the energy, not having the motivation, self-confidence, argumentative, school avoidance. Sometimes they're so stressed that they want to not go. And then it comes into this experimenting drugs and alcohol. So teens, when they have stress, these are a couple of reactions you will see with it. And source of stress in teens, both there's good, the bad, the ugly. Everybody has stress. The perception matters, right? So everybody, all of us are kind of going through stress. The teens have a different perception of things. There's a lot of peer pressure there. There's this graduation stuff, the overscheduling of classes. There's a lot of violence sometimes in boys. You see these arguments, bullying, tough classes, teachers, sexual harassment or inappropriate behavior, classes that kids sometimes don't talk about. Sometimes working a job while they're at school, getting into college, sibling rivalry, comparing kids off. There's family, verbal or physical abuse, leadership questions when they're really applying for big positions in school and things. Having a relationship, which has sort of become a pretty common thing in high schoolers, to divorce or divorce in family and family conflict. So common stresses in teens. Stress really is where we're talking about stress once like a 911 reaction. Stress happens, fight, flight reaction happens. Stress can have a mixed reputation, right? Stress can be good. Good stress gives you the burst of energy, helps you be motivated, complete tasks, protect you from harm, sort of knowing that something bad's going to happen, you're more activated and you're doing the work. And sometimes stress in elementary schools can be really finishing up the homework in the day. And then stress can be bad when not managed. So I often talk about this as good and bad anxiety. Really, when you understand anxiety, it's really kind of saying, okay, this is stress, and there's good anxiety, which means you're really able to handle it. You're worried about your finals, and you're really motivated to finish the work, keep up with it. You organize yourself. You overschedule yourself with classes and tough classes because you know you have the potential, and then you push through rather than being distracted with being on your phone and things like that. So there's a good anxiety and the good stress, and then the bad stress. Bad stress, when you sort of take that anxiety and it becomes dysfunctional. When I say dysfunction, is you're not able to manage it, and you start having headaches, mood, anger, depression, appetite issues, concentration problems. Your skin starts showing with acne, your aches and tension in your body. You're constantly feeling tight in your body. Your heart's racing fast. You're having palpitations, nausea. Sometimes people complain of feeling like GI symptoms. They're off, constantly feeling like knots in their stomach. Sometimes people take it to a whole new level of diabetes. Diabetes is now really being studied, but how autoimmune disorders are stress related. And then people have constant diarrhea. Sometimes young girls do not have their cycles regularly. So a lot of things, stress can lead to this anxiety and other disorders. So really understanding what is anxiety. Anxiety is an overstimulation of situation and underestimation of my ability to handle the situation. Such a good point for me. I really kind of felt like when I feel anxious, it's really my body telling me that I can't handle the situation. I push myself so much that my body has to tell me through anxiety that this is, you underestimated your ability of handling the situation. And I think it took me years to understand this. Anxiety is always seen as a bad thing. Oh, you're anxious, that's bad. You're worried, that's bad. But worrying is your physical body telling you, no, this is beyond what you can handle. You need to kind of slow down or change path. And sometimes that's where really I find it hard with adolescents, right? Sort of saying that, hey, you may be taking too many classes. They don't want to listen to that. You come with anxiety and panic attacks to my office, and I'm like, maybe you need to cut down. Maybe you guys need to not have high expressed emotions. Maybe you guys, but it's like, no, I really have to. I have to keep up with this grades. I have to keep up with sports. I have to keep up with this. And it's hard to understand. And then I really tell them that this is your body telling you, nope, can't do this. And that's why I'm anxious. So in adolescents, the often presentation of anxiety can be generalized anxiety disorder, which means you're worried about everything, anything, constant worry, constant rumination, feeling always anxious. Then you have that with the panic disorder. Panic disorder means when your really body has physical symptoms of these episodes. So when you're anxious, constantly worried, but panic disorder is something where you really have an episode where you're physically having symptoms of shakiness, tremors, abdominal pain, nausea, finding it hard to breathe, and feeling like impending doom, which you feel like something bad's going to happen and you're going to die. And you have these episodes that are lasting from 20 minutes to an hour or two, where you're really unable to move, do things. And the more the anxiety gets worse, the more the panic attacks get more often and more common. Social anxiety disorders, I mean, kids they may not present with anxiety disorder, they may not present with panic disorder, but they present with something called social anxiety disorder, where they're unable to get out, not able to go to HEB, not able to do their task, not wanting to go in people, feeling claustrophobic when they're around people, not wanting to attend social events, not social gatherings, want to isolate in their room. Something kind of think about. Often people have this and they don't talk about it. And then parents sort of just ignore it. It's like, oh, my kid's not interested in going out. But something to kind of keep an eye on. Separation anxiety disorder, more seen in elementary kids, less in adolescents, but often kids are afraid to leave their parents, present with different things. It seems so simple, but sometimes it's almost like school avoidance, not wanting to go away from family, staying, not talking, not communicating. Some kids present with selective mutism, part of separation anxiety disorder. They're very good at talking in front of their family. When they go out, they're not engaging or talking to things. Again, comes with another thing is specific phobias. It all depends on what the kid is. Phobia about going somewhere, phobia in sitting in cars, being involved in a car accident, traumatized by some incident, and you suddenly have this new phobia. And then other anxiety disorders are obsessive compulsive disorder, where you're constantly checking on things, having to do the homework certain ways, recorrecting self, a lot of perfectionism, which gets dysfunction that it avoids you from being able to participate, engage in a normal way. Eating disorders is the new thing. I didn't want to kind of go it because it's its own topic of its own, so I just left it out. But eating disorder in itself is an anxiety disorder, anxiety about body image, how you appear. Seen in boys and girls now, both. It's not specific, but really peer pressure, appearance, not feeling, wanting to control all your anxiety with eating. Watching your calories, restricting your food, because you can't control your home situation. You can't control anything. You're anxious about what family conflicts at home. You can't control how your dad talks to your mom, or your mom and dad are yelling at each other. So you start controlling your own food. It's part of an anxiety disorder and takes a whole different chapter. So we will not talk about it, but something to consider. Part of anxiety disorders is an eating disorder too. And then post-traumatic stress disorder, just having a trauma and reacting out of it in anxiety. Anxiety really comes from this whole control thing where you feel like you want to control things and you aren't able to do it. And usually begins at in adolescence, usually puberty, and it usually ends with the assumption of an adult role, often because there's a lot of hormonal changes, physical body changes, cognitive changes, your brain's growing, social, emotional, suddenly your expectations of what you're expected to do, right? Elementary school, your teacher helps you. You have one teacher who gives you homework and does things, but suddenly emotionally you're expected in middle school and high school to go to your own classes, manage it all. Being able to emotionally control all of this and be able to keep up with your grades. Nobody's checking on your grades. You really, the teachers are not interested in trying to tell you what to do. So there's a lot of social emotional development that comes with stress and anxiety can be problem. All of these domains, so physically, right, because of the appearances. Physical challenges is usually pubertal onset, right? 10 to 12, 13 to 15. In boys, the biggest struggle is your body's kind of going through chemical changes. There's a lot of chemical dump in your body, and your body's not grown up to take in it. So there's a lot of adjustments with that really comes in and presents with some of these depression, anxiety symptoms, because it's all chemical based presentation. And then idealized body image, there's a lot of that now. Trying to find what definition of what makes you look pretty, what makes you look beautiful, acne, physical appearances. So there's a lot of those physical challenges that come in. And there's now the whole emerging sexuality. Wasn't such a big problem before, but I think it's a whole new challenge, especially for our kids, knowing that to be politically correct and knowing what you have to say and using the right pronouns, sexual orientation, what it means and how to say it, how to express yourself, and awkward development, acne, growth, voice changes. And then at the same time, there's a huge influx of this curiosity of alcohol and drugs that's happening around you. All the things that kids have to physically kind of take on when they're adolescents. So normal stress concerns, right? I really wanted to break it down to we always sort of talk about teenage behavior and we talk about what's allowed, what's not allowed. And then what if our kids are questioning our values, questioning career, questioning religion. Questioning actually is not a bad thing, right? They're trying to understand and ask questions. But then chronic arguing is the opposite of it, constantly kind of being challenging about it. So normal teenagers, it's pretty normal to question things and be able to have those conversations. But when they're constantly arguing, then that sort of is an unhealthy stress thing. Seeking peer approval or parental approval, common, pretty, but then when it comes to the point that it's complete withdrawal, isolation, staying in your room, playing video games, not engaging with family at all, unhealthy. Moodiness, right? Up and down with hormonal changes, but moodiness that interferes with social or academic performances. I just wanted to bring these things and put it out because I think people often talk about, when kids are kind of in a deep stage of depression, anxiety, and I ask, how come you didn't notice this happening? And they're like, oh, well, I just thought it was teenage moodiness. By moodiness that interferes with social or academic, grades are dropping, not engaging, not involving in family dinners, not being part of the family and things. That's unhealthy in a way. This exploring different style, friends, interests, but then sort of sneaking out, risky sexual behaviors, missing out school, and then talking about sexual oriented expression. There's nothing wrong to talk about or engage or express itself. But then when it starts getting into really finding themselves under peer pressure, then we really have to start saying which of this is unhealthy. I do not want to go on that sexual orientation conversation because that really needs more of an expertise from an Islamic perspective. But I think that's something for us to even be aware, watch out, manage in a lot of ways. And then trying to educate. We often sort of say that if we didn't talk about the topic, it's not there. But I think it's now the time to kind of be able to have this conversation with that kid, because the best education can happen at home. And really kind of explaining that if we don't know how to do it, then we need to kind of reach out to our scholars, find out. There's a lot of education online by Yasser Khadi on all of these topics. Reaching out and listening to those kind of conversations online as a family and understanding it, so we talk about it rather than pretend that does not exist or not talk about it, because that leads to more of that unhealthy, if the questions are not answered, unhealthy ways of getting those answers and unhealthy explanations may arise. So, and then healthy cognitions is, often feeling like, okay, I feel uncomfortable having acne, pimple. But the next thing is you're not going out because you feel like you're not pretty enough, you have acne and all of those things. Sometimes sort of saying statements like, nobody understands me, to nobody understands me, I'm going to be by myself, I'm not good enough, and those depressive symptoms. Sometimes really kind of obsessively calling parents names and saying different things, to sometimes getting to the point that you need constant reassurance. And then wanting to do things, doing their best at things is fine, but when it gets to the point that it's dysfunctional, taking them longer time to do the same thing, arguing over things, worrying excessively, and just sort of things like that. I don't care whether or not I do well. It gets to that point versus I don't have to do my best. So there's a fine balance between when a kid's not doing well versus when a kid doesn't care about things. And then understanding those healthy and unhealthy cognitions. So I wanted to jump into CBT as a treatment. I can go on about, we can talk a little more about anxiety and how teen anxiety presents, but cognitive behavioral therapy is a good treatment. And I wanted to kind of jump into the treatment talking about it so we can talk about where it starts, right? This is my favorite example about eating disorder kids. And eating disorder kid sees a piece of cake and thinks, I'm going to not eat the cake because I'm going to gain 10 pounds out of it. It's an irrational thought. A piece of cake does not lead to 10 pounds, but there's a lot of thought process that has gone into this automated negative thoughts that comes into this child's mind. And really understanding those things. And there's a lot of those if you can reflect, as a parent myself, if my kid does not do well or her grade drops, my next thing, I'm yelling, screaming, and kind of telling them they need to improve their grades. It comes from the fact that I have automatic negative thought there in saying that if my kid failed the one grade, it's never going to do well in life and never going to be okay, and things like that. And then it starts off with my own anxiety, and then I'm trying to kind of improve things with my anxiety. Something to control that anxiety is like I yell back and tell them that they need to improve their grades. But honestly, it's really a very automated negative thoughts. Is one grade of low grade doesn't mean that it's going to change all their life. But and that's where that CBT, cognitive behavioral therapy model, comes in. Is you work through this therapy where you're really restructuring your thinking, right? Because when I'm thinking, she says she's got a low grade, I'm not saying, wait, okay, this is one low grade in 10 other grades. I need to not get upset about it. I need to really kind of, so cognitive restructuring and looking at a bigger picture, really understanding this, and then sort of working through this exposures of, is it really that bad if you get one bad grade, and then you work through coping skills and things like that. In a similar way, having the kid learn about some of these things, because if I don't do well, if I have one acne, I am not pretty, I'm ugly, nobody likes me, and then it kind of goes into this whole self-confidence, and then you really figure out challenging those negative thoughts, figuring out how you work through it and help the kid work through developing some coping strategies. And then that cognitive restructuring is, again, talking about what does this thought mean and breaking it down to say, does having few acne make you pretty, and what is prettiness? And defining that and helping your kid identify that automatic negative thought that builds towards self-confidence and anxiety. And then just testing those automatic negative thoughts and going through it. Coping statements, right? The often part of, I think we've been blessed with a very beautiful religion, alhamdulillah, to kind of have that coping statements in so many ways of what it means. One is gratitude, right? Being thankful for what we've been given. And when we have things and we feel it's enough, then we're never feeling so challenged about asking for more sometimes, and really kind of teaching those kids sometimes the gratitude about what does it mean to be pretty, or what does it mean to be good at school, and what does it mean to have enough. Because I think we're in this world of instant gratification where our kids are more challenged about wanting things more and more and asking for things, which really creates this whole anxiety about I'm not good enough at, and that's why I need more. So really kind of trying to create more coping statements as a family in general, with self-talks, rationalizing, and talking about how to handle things. And then we can talk about panic attacks in a minute here. And then tolerating distress, feeling like I can't do this, and how do you work through it? People sometimes sort of get to this mode of I prefer being anxious to avoid school people challenges altogether, and trying to kind of tell them I can't handle this and I can't do this, and what it means, and teaching kids through therapy on tolerating distress. And then family therapy, there's a lot of this that I really feel works in, because anxiety personally for me feels like anxiety is like cough in medicine. If you cough, your child coughs, you go to the doctor and said, hey, I was coughing and I gave my child the cough. Anxiety is very similar to that, except we all have a different cough. So we have a different anxiety. I may be anxious. I'm anxious all the time, kind of going, telling my kids, let's go, let's get in the car. I'll be getting late. And then my kids have to remind me we're going to the grocery store, not school. So it has to sort of, and then what does my kid do? Is a sponge, especially my younger kid would probably take it on and present their anxiety in different ways, crying, being upset, being overwhelmed in different ways. So it's really, anxiety is like cough and family. It's equally contagious. You have it, you transfer it. Somebody gave it to you because they want you to be somewhere on time, and they're like calling you and bothering you. That's their anxiety, and they're transferring it to you. You take this on, you transfer it to your family. But except that we all have different ways of presenting. Your girl might present with isolation and sort of staying in the room, versus your boy might present with more irritability, anger, feeling frustrated easily. These are all signs of anxiety. And I think that's where family therapy comes in, really identifying who the identified victim is, in a way of, hey, I have anxiety and I yell and scream at home, and that's why my kid presents with all of these other anxiety symptoms. And really kind of working on that, identifying the existing and solving that problem. And for me, I often, when I do the family therapy, I kind of educate parents by saying that, or the child, right, that we're doing therapy, and most often kids do not want to do therapy because they're thinking, hey, am I doing therapy because I don't want to really communicate with my parents? Or the parents saying, I have nothing to say, or it's not my problem. But family therapy is really teaching your kid to be more of an adult, saying, if I had a problem, how would I be able to communicate? So it increases your communication strategies, doesn't matter who it is with. And if you can communicate well with your parents, I say you can communicate with anybody in the world, in your leadership role, in your partnership role, in your workplace, in your college environment, wherever you go. It's really learning to build those communication strategies rather than thinking, I'm learning to communicate just with my parents. So family therapy has such a big role in understanding anxiety and kind of working on it. And then anxiety timelines, a lot of finding what good anxieties and bad anxieties, breathing, meditation, mindfulness. There's a lot of all these tools, and there are some of these resources, and this should be there on YouTube if you guys, once we recorded this session. So here we are. I can talk a little more with Nudrat about anxiety and questions. So that's it, Nudrat, for me on the thing.
It was
Thank you.
good, mashallah, to open up a discussion between the teens and, whatever is going on, and, to reach out for help, just to say it is okay. The most important thing is it is okay to have all these feelings, your anxiety or anything. It is okay. It can be worked through. This is the most important message I want anybody here who is listening to get from this, is that it's okay.
Right. I mean,
Think
that
of
is such a good point, right? I think when we have diabetes, we have cough, we have hypertension, we're quick to go to the doctor and say, hey, I'm
exactly.
struggling with this. But when it comes to depression, anxiety, it's equally the same way. And I really wish we understand this more, because it is an overall functioning, at least in diabetes is the one person that's affected. When it's anxiety, the whole family is affected. And we sometimes miss out on understanding how important that is. for the whole family in so many ways.
Absolutely.
Because our anxiety presents in so many forms and ways that if you're not educated, we won't understand. It took me like so often. I do this with my kids, right? I'm sitting in the car and I'm rushing them. And when I started understanding my own anxiety, and then it sort of felt like, that's right. I was just anxious and I'm yelling for
Oh, I
at my
totally
kids.
relate to that because it's like
Yeah,
morning and it's like 7 5. Come on, we're going to. But again, we're getting late. We're getting late. We're getting late. And then I'm like, no, let's change the words. Let's say, let's get in the car. Let's take a minute to do this. Let's do this. Let's do this. Constantly changing the way we talk, the way we communicate. It is so important, and it is anyone who's listening, we are two doctors talking here.
yes,
And I want you to hear this. If as physicians we are feeling this and we are going through this and we are still learning in the process of learning, we are not perfect at all. We are way beyond that. We're just, even
yeah,
just I would say in the process of learning. So I can imagine the people out there who are still don't even are not even aware of this. So our goal here is to just give you that awareness that yes, this could be coming from this emotional state that you're going through, and it is very much something that you can go for treatment for. Just talk to people, and it is, you don't have to always just go ahead and start a medication. I
right,
see a
right,
lot in primary care myself this, and I tell them that go start off with something to find out your triggers, as we call. The most important thing is find your triggers, what's causing it. And it takes time. Be patient with yourself and through this process, because it does take time, and celebrate your progress. Like, just if you look at it, and if you look at, the progress, as Afshan is herself saying, I have through the years noted. You mark the word, it was years, and I myself would relate to that. That I through the years noted that that this is what I am thinking. Oh my God! Like, if something comes on to me and I'm reading my kid's report card, and then at the end of the day I'm feeling stressed out about it, and then yelling at them for another reason, not even bringing that report card out. I was just thinking maybe it was that thought stuck in my head that led to me reacting this way. If I would not have had that, I probably would have reacted way differently. So these little things that happen to us every day kind of make us more aware that the next time we kind of think, hold on, take a step back and let's do this differently. So it's a process. It is going to,
right. And
just
this is why I stepped away from talking about medication at all, because my goal is not talking about anxiety and medication. My goal is really kind of talking about simple things like that. This
absolutely.
awareness of understanding of what that means. And you have to go through a panic attack and anxiety to really understand and relate. And more often, men, I think, is another population that really don't talk about this, don't talk about their overwhelming anxiety sometimes, and presents often an irritability in men population and boy population, and seeking other ways to be distracted, right? Be you anxious, instead of really addressing the anxiety, you're zoning out by watching news or watching sports or watching TV constantly, using those rather than kind of coming up to saying, okay, I'm anxious and I really need to work through it, figure out why I'm anxious, and communicate with my family about what I'm anxious about, rather zoning out and distracting with things. So that's something to kind of really understand and talk about. And the goal is to really say what is anxiety and how to kind of identify it.
Yeah.
Uh,
Yeah. Yeah.
and
I'm
what
not able to see anybody's messages out there or any raised hands. If any of you who have questions, we can let you talk and you can raise your hand. I do see one question here. Can the physical, I think the physical symptoms come first and that lead to anxiety? I'm not sure if I'm anxiety or haven't been able to find any other cause for the physical symptoms. Afshan, you want to take this? I think what is like the somatization, the somatic
right,
symptoms, can
right.
they be a
And
presenting factor is what the
yeah,
question is asking here.
yeah, right. No. And then I'm gonna let you also answer this because you see this in family medicine a lot. But as a child psychiatrist, honestly, I get 30% of my population actually has been kids presenting with headaches, been to the neurologist, CT scan, brain MRIs, all kinds of the times. Takes months and years before they're like, oh, by the way, go see a psychiatrist. And then we come and talk about it. And my child's never been anxious. I'm like, but he's got headaches. But no, we have no problems. And then you kind of work with the family. And in 6 months, you know how much better the kid is because we're working through family therapy, working through same thing with GI symptoms. The kid is having tummy aches, not going to school, tummy aches, been to GI doctors all over the country. They've gone to Mayo Clinic, got all the GI tests, then they're like, oh, my kid's not anxious. And then they got finally somebody says, go see a psychiatrist, and they come to us. And then we're starting to identify the anxiety and talk about it. It takes an expert sometimes, right, to identify that anxiety. So sometimes you just have physical symptoms. And more often, actually, the physical symptoms appear 6 months after you've gone through a stress reaction. So when you're going through the stress, you're not knowing it, you're able to handle it. You had a loss of family member, divorce, financial losses, things like that. It happens, you handled it, it's over. And then 6 months later, you suddenly present with this physical symptom, jitteriness, unable to feel burning sensations, different kind of things. And they're like, I'm not anxious. I don't think so. I'm anxious. And then really kind of understand this from an anxiety perspective. Sometimes treating the anxiety helps work through it. But yes, so it can present with physical symptoms way later, or you may not feel anxious and still have panic disorders and anxiety. We're not able to sit and be restless and all of these things. So definitely anxiety, just different kind of presentation. So Nidal, I'll let you talk about what you see in your family medicine practice.
Well, I do relate to that quite a bit. But yeah, the one thing is, yes, physical symptoms can present. It depends on what your symptoms are. The most common things we would see is headaches, um, abdominal symptoms, as you said, stomach aches, could be diarrhea, could be constipation, as we call the irritable bowel. And it's just, the gut feeling, as they say, the gut does react to your feelings. So it does, and it may show you in different ways, because we have done every scan on that is available, and all we can find out is they've even got a scope, and the gastroenterologist is starting them on anti-anxiety medications, and they come back to us and we're like, okay, we know that from the beginning, but we have to first work it out. That is there. We do the workup, but we have to also address it simultaneously and think about it. Palpitations, just the tingling numbness around your mouth, in your fingers, in your hands, feeling tired, feeling very, very fatigued most of the times. It could be an emotional, it could actually be because of another thing, some anxiety, something else, depression. You have to look at that, because I do see that very commonly. There's something called as chronic fatigue syndrome. And that is another very common presentation that I see in the practice. And these are things that, we have to all kind of, you can present with them, as you said. But one thing that even I learned was that it can present even up to 6 months later of your initial event of stress, as you said. And that time when we're actually talking to the people, or any person is like, I am not feeling that anymore, I'm not feeling that that was there, it was gone, or somebody, a death happened in the family, and there were a lot of things, and it's already done and gone, and but still after that you're feeling like that. It's probably because it was not coped with in the right way. Maybe you did not process that completely, and then now you're presenting with that. So that's a possibility. So seeking help for that definitely will
And
help.
it's interesting. They did a research in India. Indian women, 45% of people who present to a clinic with back pain have depression and anxiety. So the most classic presentation of depression and anxiety in women in India at one point was back pain. So they're complaining of backache and not able to do housework.
Yeah.
Uh, and then when they started treating the depression and anxiety, the back pain started getting better.
Well, I will
So,
tell you a story without disclosing anything. Is one of the people I saw was uncontrolled diabetic, hypertensive, a lot of other issues, and constant pain, like constant pain in the throat. It's burning, everything's burning, burning. And right from the beginning, I was like, in the back of my mind thinking, is this anxiety? Is this what's going on here? And then give a lot of medications, treated everything. And then one day, just suddenly, explain that this is a medication that may help you, and go talk to somebody. And thankfully, the person was not feeling, because apparently maybe that their feelings were not kind of important to them. They never thought of feelings as leading to any kind of thing. They all were, the only focus was this pain, the burning, the pain was the focus. And after the way I treated with some anti-anxiety medications, I have not seen that person come back to me every few weeks or months with that pain anymore, and everything else seemed to be controlled well. So it was like a recipe, it's such a stress response to the body that the sugars were not being controlled. Everything was up and down, and it was just a total chaos. So once they processed that, that improved, everything else improved. But the other thing also is, as you said, the pain and aches. So definitely one of the things I want to share is also exercise, any kind of movement, deep breathing, abdominal breathing. These things are helpful, very helpful, very, very helpful. Like,
I
recently,
say
I think I
often,
read a study or I was looking up something that deep breathing was compared to medications also, and something
yep,
was being
yep.
compared in the study.
I mean, in future, it's not going to be, forever. There was this first world country and third world country, and and moving forward, I think it'll be healthy versus unhealthy. Lifestyle medicine's taking over, and that's part of it, right? Giving your feelings, your emotions, sleep, appetite, your exercise levels as a whole priority, and calling that the treatment rather than what you eat. You are what you eat. So if you're eating junk, you're not taking care of yourself, not eating on time, not sleeping, not physically being active. How many teenagers we have who are physically active? They don't sleep on time. My older ones started drinking clean, and I kind of, it takes a lot of education to tell her you can't be drinking energy drinks to be able to overschedule yourself, take your classes, not sleep. But there's lack of understanding of time management. And then next thing they know is they're anxious over little things, and then it comes out with all kinds of reactions. So this is where the work needs to happen, in a way, understanding a teenager's sleep patterns, um, exercising, physically being active. We go out as a family to go eat at a restaurant. That's our outing. Instead of saying, let's can we go take a walk in a park? How do we change our lifestyle? And those kind of things. Um, so yeah, exercise is a big part of what we are doing, and how we can manage all of that, breathing exercises and mindfulness, and giving ourselves 5-10 minutes. Honestly, just sitting after Fajr, just 5 minutes, going through your own body, going through your own emotions, going through your feelings. It's an amazing change. It's 5-10 minutes sometimes, but just that mindfulness of what your body showing gratitude, being thankful, uh, changes your perspective on things. And these are the things that we really need to work on. We don't model it, teach it to our kids, and hope that they will pick on those things.
Absolutely, absolutely. And I do want to say that I don't know about you, but going through medical school, I had headaches.
Yeah.
So the headaches would be immense. Like, I was thinking, what is wrong with me, without even understanding it was the stress going through the school itself was leading to that. And at that time, probably, not even had learned about anxiety or it came much later in the years that, learned about all of that, that's what was going on actually. And but now learning ways to process it, and time management, as you said, we have a world which is so busy, and we have so many things we want to do, so many things we want to achieve through the day. We want to be more productive, as we call it. Are this, now this is a new challenge with the
It
newer
is.
generation. We want to be called more productive in everything we do. But again, you will be more productive. And I realized that until a few years ago, I used to just run, 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 run. The whole day would be there. But the productivity increases once you realize your own self much better, and you're more mindful in doing what you're doing. We do
And
have, we
giving
did.
giving value and priority to things, right? I'm equally guilty. Think about the teenagers, but I sit on Instagram and I'm 30 minutes down and I'm thinking, why did I have to know this about that person's life? Um, and my 30 minutes of my time's gone. And this is what the teenagers do, right? They're focused on wanting to know things about so and so celeb, and they're sitting on TikTok or they're sitting on Instagram, constantly scrolling. They don't have concept of time. And then when it comes to really kind of taking care of themselves, they could have done 30 minutes of taking care of themselves, but no. They call that entertainment, watching YouTube videos for hours. You can't challenge that directly, but you really have to, for us to really even understand that we need to educate ourselves before we even approach our kids and say, how do we educate them and give them the tools? So time management's
But
a big
this can happen very commonly. I mean, if it happens with you and me, but
in
what
my
is important is, again, as it's important, it's good you say that, because this happened to me this morning again. As you know, I was doing something and got distracted with Instagram because I was looking at an event that was going to happen, and instead of looking at the event, I went at another thing.
yeah,
10 minutes gone by, my mind quickly was like, hold on, where am I right now? And I'm like, that thing about where am I? Keep a check on yourself
mindfulness,
constantly. that
right?
that is mindfulness. Where am I, what am I doing, and why am I doing this? Connect those things. And most importantly, as Afshan said, that our deen teaches us, almost, it's a way of life. It is a way of life. Connect
Yeah,
your things with Allah subhanahu wa ta'ala. Look, what is your priority? Is this what I want to do? Do I want to know about this other person at this time? How is this concerning to me? As we all know, what is not concerning to you, you leave it. The entire treatment of everything is there. So everything that we have learned, when we apply it, you will see mindfulness is that, okay, it's not concerning to me, I'm going to leave it.
yeah.
Because then it's going to bring you that anxiety. Oh my god, that person did that, okay, maybe I should do that. You're trying to compete, you're trying to have that peer pressure around you. No, it's not
And
concerning.
on that same role modeling is such a big part, right? I mean, I have, if my child has teen anxiety or is dealing with some struggles and is not willing to accept or think, can I get help? Can I start looking at what role modeling I've done? Forever I've sought help outside. I want to get my kids the best tutor. I want to get my kids the best Quran teacher. I want to get my kids the all the classes that are available at the masjid. And I've never sort of looked inwardly and sort of said, what am I contributing? Am I sitting with them 10 minutes and really having a conversation which does not involve talking about their grades, talking about things or negative? How is the bonding going on? Am I sort of, and often this is my constant thing is family, weekday family dinners. The whole concept of family dinners sitting on together on tables gone away. We all eat at different times. We all are kind of rushing to do different things. But what weekday family dinner, Wednesday, I say pizza night, where you sit down, you're not talking about grades, you're not talking about finances, bills, but you're just talking about whether it seems so fake, but really kind of building that bond where there's no negativity in any way. And being able to engage in how are you doing and having that conversation and really building that role modeling, that mindfulness ourselves, sort of checking in and really talking about it. The best times for me is picking up my kids from school. I really enjoy that. I can't give away that because I feel like that's the best time to really engage and talk about non-judgmentally talking about their struggles and um, asking them and giving them that time. So I feel
I
like
mean,
personally the work I need to do is role model myself about mindfulness and prioritizing and giving that time.
yeah, absolutely, absolutely. Any other questions anybody has? Anything else that we can address before we close this? And we do have, we want to see how we can best put this together coming forward in the next month or so, is the resources that are available in the community. So anybody who wants to seek help can approach the therapists who are there available, and they can reach out to them. There are many groups now in different massages who do hiking, who do fitness classes, as well as a lot of them. I know there is one at an MCC which I myself attend, and I would highly encourage. ICBC has one. We have these resources, and the trainer is wonderful. Her name is Rana, and she's a yoga and a martial arts trained professional, and she does a lot of these meditation and deep breathing techniques, and subhanallah, it is very helpful. It has actually put an insight to my own self in learning those things through the day. So it's very good. It is very good. Whatever you can do, whatever you can join or look up and do for a few minutes every day, it will help.
Yeah, alhamdulillah.
Inshallah. Inshallah. Okay, so we with that we end here, and inshallah looking forward to the next month session. So we will see you again at the third Saturday of the next month, inshallah. So we end with a dua. Subhanakallahumma wa bihamdik ashhadu an la ilaha illa ant astaghfiruka wa atubu ilaik. Thank you so much, Afshan.
Thank you, Nada. Like.
Wa alaikum assalam wa rahmatullahi wa barakatuh.